Today's topic is aspects of auditory learning. This is basically with reference to how our ear, that is peripheral hearing, and then the central processing works to learn different stimulus, auditory stimulus that may be known, unknown, that may be speech or non-speech, whatever it may be, through the auditory mode. So there are a lot of procedures, lot of mechanism, lot of physiological backgrounds, anatomical backgrounds are there. Even how pathology will impact that and what are the different solutions that I will discuss. First, I have to explain about the three major types of behavioral learning. As we all know, that first is the classical conditioning given by Pavlov. That is, a neutral stimulus is associated with a natural response. So unconditioned stimulus, gradually there will be a conditioned response. And when we give the rehearsal, so the bond will be strengthened. Next is the Skinnerian approach of the operant learning. That is basically a response is increased or decreased due to reinforcement or punishment. So it is basically the reinforcement system. Can be used with reference to, there are a lot of contingent reinforcement or reinforcement schedules are there, and a lot of trial and error is also there. So this is basically an operant learning, because there are a lot of pedagogies are there with reference to operant learning regarding when we are providing therapy to the hearing impaired children or children with some auditory processing disorders, dyslexias, etc. And observational learning means it is given by only Bandura, and then there are a lot of other theorists like Guthrie, Hall. They have given observational learning, means learning occurs through observation and imitations of others. So it is basically a experience, learning through experience, basically. So the next is basically the how we can learn. There are some process are there, or some stage-wise process are there. What are the different stage of hierarchy? That is how we describe first the concept and we explain the inherent meaning, and then we can predict what actually it is there. It may be positive, it may be negative, and we can provide reinforcement accordingly, and we can control our language or our thoughts, etc. So what are the learning style? The learning style may be physical, that is due to with reference to your bodily body has a lot of body movements, etc. We can learn. Hands movement, hands activity we can learn. Haptic activity, that is touch, is also a physical mode of learning things. We can have a verbal learning mode that is responsible for especially to stimulate speech when we are providing words, writing, and speech to the children with or adults with a lot of hearing or auditory processing disorders. Both the case we can use that. And also there are some solitary learning with self-study. So individual can learn on its own. Social learning means in the group communications we can learn a lot of things. Logical learning means you are learning the behaviors or learning the language with reference to different type of reasoning or different type of executive functions. It is there in the higher order. Visual learnings may be with reference to image processing and color processing. And of course, the important part is auditory learning. That is, you can have a lot of different signals, including music. So I have to talk about associative learning. So associative learning, it defines a learning situation when two stimuli become linked. Elements of one stimulus then become associated with the second stimulus. Means we can give a dual stimulation approach. So both the stimulus are linked. So if I have one stimulus in a strong way, so other stimulus can be automatically associated. And there are some other definitions given by Hauer and Hughes in 2020. This is a recent one. Associative learning refers to situation in which the combinations of stimuli leads to changes in behavior. Like when we provide signal to noise ratio, and we have to understand signal instead of noise. There are a lot of associations is there. So question is like if there is a stimulus like beloved celebrity. So what is the associative stimulus? He is always coming with a car. So result beloved car. In that way, we can associate it with learning. So learning style is basically, we know, visual in graphic and flashcards modes. We can provide stimulus. Auditory means lecture or music stimulation. Physical, under physical, there will be an hands-on. It's direct. We are giving some in workshop. We are providing hands-on movement sensations, haptic sensations. Verbal is writing and presentations. Solitary is independent or individual learning their own with, and then social learning is basically in the social gathering, uh, collaborative learning it is basically, and logical basically with reference to recognition of pattern, and of course some statistical part, that is probabilistic methods. So this is the learning pyramid adapted from national training laboratories, and you see the only 5% they are actually under the passive teaching methods, the lecture, reading, audiovisual, etc. And the highest is of the, when we are participatory teaching methods, means highest level of learning is when we teach others. So that will basically, that is very important, that we can have a lot of discussions, lot of practice, and that we can learn lot of different things. So this is the mixed learning approach. Even this type of methods can be used in machine learning when we are talking about AI, especially in case of the deep learning, or we can have the narrow neural network we use. That time, specifically for reinforcement learning in machine, we use mixed learning approach all the time mostly. So auditory learning is basically with reference to interactive learning. So when we are interacting, we can learn a lot of things. There is actually exchanges of thoughts and ideas with the different individuals. Individual can learn on its own because they know what to learn, and that is just like we are reading books and we are learning from the books. Open door learning means it is an open platform we can learn. Cooperative learning means a lot of different peoples are learns in a same topic. Visual learning means like image processing, etc. Hands-on learning, in basically in workshop we are learning when we are using the procedures first with under the guidance, then or supervisions, then without supervisions maybe. And fun learning, definitely if we have a fun and joyous activity, it is easier to learn the thing. So it is basically a mixed learning approach. All these modalities can produce different learning. So auditory learning has different characteristics with reference to you can enjoy listening, you may like to sing, you may talk a lot, you good at explanations, read out loud, all these characteristics. And what are the study habits? You are watching videos in YouTube, etc. When you can see reels, there are a lot of knowledgeable reels and YouTube videos are there. You can listen to music, you can use songs to memorize like mnemonics, etc. Then you can put things in your own words, and also you can study in quiet places. Always I prefer that, because if there is a noise, sometimes I feel there is a distraction. So an auditory learner, so basically they follow oral directions very well, and they are effective member of research groups if we take them as a different type of researches like the binaural processing, binaural integration, a lot of audiological learning researches we are doing. So those persons who are auditory learner, we can use them, and sometimes they are maybe a gifted storyteller, like they works in great in groups. They're able to solve complex problems by speaking aloud. So they are depending mostly on their hearing. They can understand changes in tone of voice. So pitch changing mechanism they can understand. So pitch recognitions or loudness recognitions or temporal recognition, time recognitions also with reference to sound stimulus. And when we change the signal to noise ratio like +5, -5 in that way, so means noise, we are punching noise more or punching noise less. So they can, even in this type of challenging situations, they can understand signal very well. That is the concept of speech in noise test. And then they are skilled at oral reports and class presentations. So this is another aspect. So we know that this is our hearing system. So this is an external layer comprised of auricle, external auditory matter, there is tympanic membrane, and the mid layer is Stitchen tube, three ossicles, malleus, incus stapes. Stapes is the smallest bone of the human body. It adjusts the oval window. There is a round window also, and then you are the all sound stimulus, mechanoacoustic stimulus comes to the fluid of the there's an endolymph and there is also a perilymph. So this type of cochlea is basically uh, acts as a transducer. So the all sound stimulus is converting to the electrical stimulus, and that can be carried out by the nerve. This is the helical tremor, and then it goes to the brain. So how it goes to the brain with reference to different cochlear nucleus, olivary complex, and ultimately then the inferior colliculus there is a crossover and it goes to auditory cortex. So it is the parental cochlear nucleus. A lot of tonotopic organizations there. So here there is a mid frequencies are just like in cochlear tonotopicity. So ventral cochlear nucleus has tonotopicity. Even dorsal cochlear nucleus is having a tonotopicity of, like, here is a low frequency, mid frequency, and high frequency coding. So this is basically the different pedagogies of how sounds are located in different areas of the brain, including Broca's, Wernicke's area. So this is actually the hierarchy of our learning. So starting with the neuroreflexes like Moro's and other reflexes, it comes to sensory system. So after reflexive level, we develop different senses: auditory, tactile, olfactory, everything. Then when we are master in the sensory systems, then gradually we start understanding the motor behavior with reference to some body schema. We know the oral praxis, the postural security, bilateral integration, etc. And then it comes to sensory processing or perceptual motor functions like auditory tracking, filtering, eye-hand coordination. Then speech development is a very important part in this particular stage. Visual perceptions, input screening, and sequencing. Then we come to another level of improvement, hierarchical level of improvement, that is communication skills development, oral language development, body language development, word finding development, phonemic awareness, auditory memory, and visual memory. Then it comes to life management and socialization, another higher skills with reference to environmental interactions. So like play skills, emotional awareness, then activities of daily living, social skills, and behavioral regulations. When it comes to attentional and focus level, more hierarchical. So impulsivity, self-regulations, distractibility, that may be internal, that may be internal versus external, that ratio, and then hyperactivity, hypoactivity, and organizational skill. Then it comes to the highest processing function, that is executive functionings like mathematical processing, the arithmetic processing, the number processing, handwriting, reading comprehensions, judgment, problem solving, etc. So there is a developmental milestone, as we all know, that 0 to 3 months means baby will get a shock when he hears a loud sound. So there will be a reflexive, oropalpebral reflex, Boros reflex, ATNR, STNR, a lot of neonatal reflexes are there, or that is called the primitive reflexes, not neonatal, primitive reflexes. Then 3 to 6 months, your little one starts imitating sounds like ba, ah, mom, in that way, and gradually it starts babbling. So 6 to 9 months, they can use a lot of bilabials, babblings, and also canonically duplicated babbling. So da, da, ta, ta. 9 to 12 months, they start saying words and word-like utterances like first idiomorph, then words. So what are the timeline if you see the auditory development? So anatomically, you see in the 30 weeks or within the 40 weeks, everything will be developed. And within the 30 weeks, you see mostly middle ear, outer ear, and cochlea and other nervous systems are mostly developed. And fetal can respond to at least 250 or 500 hertz frequency, and up to after the 30 weeks they can also respond in 1 and 3 kilohertz. Is called fetal testing. Newborn can responses thresholds elevated by 70 dB at least, and adult like responsiveness elevated 30 dB. If you give around 30 weeks, they can differentiate different stimulus. If you then decrease, or there are some called forced choice, Then at the 40 weeks, that child can even learn sounds like an adult. So this has been taken from the book, the Mahabharata of the pediatric audiology, as the audiologists are reading mostly. That is the Northern Downs, and they have explained very beautifully that how audiological behaviors are auditory behavior are coming up, or the growth is there for a baby. So newborn starts responding at around 90 dB in the loud noise, or 50 to 70 dB is feeling quiet. So up to 3 to 4 months, there is some head turn. 4 to 7 months, gradually these head muscles are developed, so they can trace the sound above and below. 7 to 9 months, they side by side, they indirectly baby locates the sound. 30 to 40 dB means less loud sounds. 9 to 13 months, again the growth is more. So even 25 to 35 dB SPL sounds they can listen in all around. 13 to 15 months, they can learn 25 to 30 dB. See, gradually when they're growing up, they are responding in the very low signal, so very low level signals. And gradually around the 2 years, around within the normal hearing sensitivity 0 to 25 dB SPL, they can listen to the name call, the sentences, the mother's voice, everything, everywhere they can respond, and they can start speaking also sentences, simple sentences. So this is our actually the anatomical constraints I have already given you, and we use as an audiologist lot of tests to check the external ear functions, middle ear functions, inner ear functions, even brain functions, with reference to using tympanogram, the middle ear pressure, gradient, compliance we can analyze, the ear canal volume also we can analyze. We use autoacoustic emission to test the outer ear cell function, auditory brainstem response to understand the synchronimity of the auditory nerve towards the pathway. Lot of cortical evoked potentials means we can trace brain cortical part and how the sounds are perceived. We can mostly use the speech stimulus. We can use audiogram after the 4 years of mental age. The mental age is required to perform the subjective pure tone audiometry. We use speech in noise test, even aided condition also. If the person is having hearing aids and cochlear implant, we use speech in noise test because the performance is poor if there is a neural pathology. Lead span test because we want the cortical functions to understand. We also do otoscopy to check whether there will be any obstructions in the external auditory meatus or in the tympanic membrane, etc. So see, this is the important part, that cochlear maturations, it starts from birth. So sensory cell differentiations are being started, the outer hair cells, inner hair cells, supporting cells. Then onset of functions, it starts in 10 days in there, and then end of the maturation after during the birth of 20 days is over. And then around 2 to 6 years, it is actually rat model and human model. In human, up to 6 years, the central nervous system auditory maturation takes place. In rat studies, the rat model also studies are there, so it is around 2 months. So cochlear maturations in human takes place at least 4.5 months in utero, so it is in the fetal period, and around 6 years the CNS maturation takes place. So it can be disturbed, this total maturations, if mother is having thyroid deficiency in the pregnancy, or hypersensitivity periods in this style, like aminoglycosides, those autotoxic drugs they have taken, or noise trauma, it influences the hearing. So this is a part that how do you know that there are one side there is an attentive executive functions like dichotic processing disorders, that is an ipsilateral processing. So same 1 year I am giving noise and speech, and when you use the both ear, that is the diotic conditions. So dichotic and diotic, both the conditions, there will be a lot of hemispheric involvement. So corpus callosum is the connector between right and left. Right is usually the musical hemisphere, and speech hemisphere is and language hemisphere is in the left hemisphere. And temporal lobe is basically responsible for the sound integrations, and also frontal lobe is acting with reference to reasoning. So temporal processing, that is a time processing. So if the sound is coming from this particular right ear, so this distance is lesser compared to the left ear. So this particular the distance, so it is actually giving interoral time difference, interoral pitch difference, frequency difference. So the brain can understand the where is the sound is localization, where is the sound is locating. So in that way they can respond. And ultimately, whatever we are understanding, it captures in the thalamocortical path for memory and also speech perception. Coming to another important part, that there are neuroplasticity, means how brain changes or brain matter changes with reference to different learning with the stimulus. The brain's ability to change, adapt, and regenerate following a neural injury or stroke or traumatic brain injury or hearing impairments. So first is the age matters. As young you are, so the plasticity is more. After 3 years, the critical age of language learning is over. So there will be a deteriorations, or there will be a lack of neuroplasticity. Transference is very important part. In that case, the if you practice something in a nearby area of the brain, it will transfer to other areas. So it is one. It's called one type of cross-modal plasticity. Even a blind person or a hearing impaired person is more dependent on their vision. Repetitions, you have to practice a lot of times to see neural changes. So repetitions means it is the rehearsals. So brain is adapting the stimulus when you are rehearsing more. So it goes to long-term memory. Specificity means plasticity is experience specific to the individual. That is very, very important. So individualized way, the plasticity can differ. And then the intensity, need to right amount of physical activity to cause brain changes. So the physical activity definitely it helps to improve the brain maturations. Salience has to be motivating and important to that person. So that part, psychological part is there. The temporal time is very, very important to check the change, increase or decrement of the change. Interference, sometimes new plasticity means new learning is basically sometimes interfere with the old process. But very, very important point is use it or lose it, because our nerve has two basic part. One is the all or none phenomena. There will be no in between. The stimulus may be pretend. Another thing is the refractory period. So after giving stimulus, there will be some time is required to get the response. It is called latency also. But point is that in case of neuroplasticity, if we use it more, so we can improve these things. So neuroplasticity actually occurs in different lobe like frontal lobe, parietal lobe, occipital lobe, cerebellum, all the way. A lot of functions, brain functions are there. Maybe the behaviors, problem solving, executive functions. In parietal lobe, mostly the academic part also it is there. Visual perception is there. Occipital lobe, mostly the visual perceptions. Cerebellum is the balance, coordinations, etc. Then temporal lobe is for understanding of language, hearing, and the speech processing. And the brainstem is basically from reflexive path. Even there also lot of motor and sensory motor integrations happens. So neuroplasticity is the capacity of the brain to change its connections in response to personal experience. The change comes in two forms. First, new neural connections. So new neural synaptogenesis, that is called, and the remapping of an already existing one, that is sometimes is called rewiring. As the own word says, the brain has the ability to be plastic, to be modifiable or moldable, or that is modifiable. That is very, very important. Next is the neuroplasticity can be different in this way, molecular level also, that is the genetic part. So protein systems are working mostly, and also in cellular level. First is the neuronal level, means neurogenesis like proliferation, differentiations, survival, migrations, maturations. These are all neuronal aspects. So you can form a lot of synapses with reference to the checking the dendritic spine or something. Then dendritic part is very, very important. So dendritogenesis means development of dendrites, and then synaptogenesis. These are the hierarchy. So first molecular level is basically with reference to functional plasticity. So it is basically one important part that functional plasticity occurs at the molecular level. And the structural plasticity occurs in the cellular level. That the area we have to understand. So structural neuroplasticity means the very simple way, ability of brain to physically change brain structure due to learning and experience. More neurons and synaptic connections are formed with learning, memory, and experience. This creates physical changes in brain tissue. So we use a lot of structural neuroplasticity when we provide auditory stimulus for learning in therapeutics. And functional neuroplasticity is basically the synaptic remodeling, that is the sometimes pruning, also the filtering. So neuroplasticity can take place with reference to learning pedagogy, like first characteristics of dendritic spine. So the how dendrites are develops, how dendrites are branching out. It's called dendritic trees or dendritic spines. Then properties of the membrane of ion channels, how there are different gate receptors are working. Then the hormonal activity, lot of glutamate, GABA, then monoamine oxidase inhibitor, then the serotonin, the catecholamines, lot of hormones, acetylcholine. So all hormonal activities, there are some balancing with reference to DOPA and other things. Then microglial activities are very, very important. DNA regulation system and transcriptions, very, very important, because sometimes the 4 protein structure like adenine, guanine, cytosine, uracil may be changed and makes a double helical structure. So we know that Watson Crick got the Nobel Prize uh, after the understanding of the double helical structures of the DNA. And also we have to understand the neurotransmitters, how it functions and how it's balancing when there is a stimulus. So this is the lifespan cognitive level, how lifelong learning takes place. So we are learning through our life. So social contexts, neurocognitive part, the health and lifestyle and neuroplasticity both are coming in this particular way. Like the neuroplasticity, if there is a full-fledged neuroplasticity, so throughout the life, your neurocognitive functions are being formed. Then you can form the healthier lifestyle, and then you are definitely socially mature. So actually, if you are having a lifespan cognition, this model is called lifespan cognition model, and then you can improve your foundations of learning. So this is the area, like a lot of ADHD, CAPD, learning disabilities, language disability, dyslexias, they are having the auditory learning deficits. So music, if you use music, it shapes the brain, because music stimulates the neuroplasticity. Because there are one study that there is a disruptive plasticity in different disorders, and you can use music, and then the studies are also have been used in the musician's brain. So it found that pitch, loudness, time, and other engagement with these things are developed very fast. So auditory learning strategies are basically in a nutshell, that we discuss a summary of what has been covered with the partner, actively participate in debrief activities and ask questions. We can develop an internal dialogue of what you are learning. Try questioning your partner to draw as much information as possible, and then fill in the gaps with your own expertise. And also, we work with the partner and provide a brief explanations of what is coming. So we know now what is the context and what are the content of the part. And then we can try various auditory activities such as brainstorming sessions, discussions, and verbal games. So these are all the auditory learning strategies in college life, in classroom situation, in school, in college, in university. So these pedagogies are very, very important. So auditory processing difficulties can be found in all sort of disorders. This is actually a spectrum. It may be there in not only in the ADHD or the specific learning disability or autism. It is there in the Tourette syndrome, gifted, attention deficit disorder, OCD, everywhere. So it is auditory processing is basically, it is a common term, and the different disorders are there in this particular cycle. So auditory processing disorders, we can have a types, and we have a different symptoms. It has been taken from the book of central auditory processing given by Bellis. It has 2 volumes, volume 1 and volume 2. It is a gold standard books that we audiologists are following in our undergraduate or graduate program. That first is an auditory integrations to the organizational deficits to phonetic decoding, prosodic decoding, prosodic contents, and then auditory hypersensitivity. These are the area where we have to look forward for giving therapy. So the patient is having auditory integration problem like delaying in processing or integrating informations, hard with visual stimuli, or in with competing visual input, etc. Even in organizational deficits like cognitive sequencing, etc. Then prosodic like variations of different intonations, stress, emphatic stress, etc. Different pattern of prosody. And also in the phonetic decoding, like we struggles with the reading because we don't have that auditory comprehensions, phonic skills and phonetic elements we don't know. We cannot recognize the phonetic elements. And auditory hypersensitivity means heightened sensitivity to sound, hyperacusis maybe, or sometimes there are a lot of problems when there is a noisy environment. So this is the important part that we have, we can monitor the initiation. So there are a lot of input, auditory input, somatosensory, tactual or kinesthetic, motokinesthetic input. And then it comes to the motor schema, the motor initiation takes place. It goes to the motor comments, and then the articulator movements occurs, and then we can speak. So auditory development, as we are taking care of already, we have explained that auditory learning means first the natural listening, and then we can have auditory training after 2 years. There will be also a natural listening. So auditory training and natural listening, it goes to access to sound. So ultimately, natural listening process, this is called nature, and nurture. This is nurture. Nature plus nurture means the game of auditory learning. So you see, this is the activations of the brain. It is not activated actually. See, there is no activation, but here, this red area, there is an activations. So that Stanford University study shows new neural activity after fast forward in every cases. If you stimulates, so to all these area, so speech areas, associated areas, auditory cortex, primary and secondary auditory cortex, then the different memory areas, attention areas, those executive functions are always giving impetus to the auditory learning. So auditory processing disorders in ADHD is one very, very important concern, and it is basically that the area where the ADHD and the auditory processing disorders are coexisting, there is the overlapping part that we struggles to follow spoken directions if there is an ADHD. They are easily frustrated during listening activities. Sometimes tunes to teachers and peers out. They have a hard time focusing in group discussions. So this is the area. So auditory processing means it is basically hyper or hyposensitivity or integrations, etc. But in ADHD, a lot of attention difficulties are there. But this common part, maybe it is a sequelae of the central auditory processing, ADHD, then dyslexia, etc. And we have found in our studies that this is a very, very important conditions. And we studied through P300 and mismatch negativity, got a lot of impetus in this particular area. So auditory processing management leads a lot of part which has been already there in the counseling sessions, informational counseling, psychosocial adjustment counseling. We can use hearing aids, cochlear implants, frequency modulation systems. We use auditory training, communication strategies training, frequent communication partner training, and speech training. So coming to auditory training, as we all know, for it utilizes residual hearing. So first is auditory training for auditory learning. So in case of hearing impairment or the auditory processing disorder, both can be under this particular training, emphasizing that the primary therapeutic goal is training the mind to be aware of, attend to, and use sound. So there are a lot of process in these particular integrations, and we utilize residual hearing with amplifications and our cochlear implant or hearing assistant technologies, the FM devices, etc. So this is the area that first we hear, that is the sensations, then listen, it goes to different pathway, then we comprehend in the cortical level, and such process, if it occurs very gradually and hierarchically with the complexity, more amount of complexity, the communications effectiveness are coming up. So auditory training is not necessary for you are giving auditory training only for the hearing impaired children. It can be given to hearing impaired adults, after aided conditions or implantable conditions, even we can provide auditory training to the auditory processing disorders having the higher central problems, not in the problem in the peripheral hearing up to cochlea. Then also we can provide a lot of auditory training pedagogies with reference to environmental modifications and compensatory strategies. So there are a lot of the gold standards definitions are there given by Goldstein, Carhart, and Arbor. So they're all talking about the stages like auditory awareness to discriminations, to identifications, and then comprehension. These stages are very, very important. And auditory training activities for children, like when we awareness means we can play with different sounds from simple to very complex, like from peekaboo to boom, this type of sound. So they can aware whether sound is there or not. Then they can discriminate what is the sound. So gradually they can start here mama mama papa papa, what is the difference between these things. They can identify different sounds with reference to name calling, and also they can comprehend different questions answer, the different story, etc. There are some methods already established in the world, very, very high level methods and standardized methods like DSL2 one method, Sky High one method, and SPICE. So there are a lot of pedagogies are there, a lot of procedures are there in these particular methods. Like for example, DSL2, they starts from awareness, phonetic listening, and auditory comprehension task. But Sky High, they are having different phase. So for 7 months, they starts attending that part, attention, then early vocalizations. Phase 2, they start recognizing sounds, localization, and vocalizing. Then phase 3 to 9 to 14 months, older children, hearing a distance and levels, they producing some vowels and consonants. Phase 4, they can use the environmental discrimination and comprehensions, etc. So this is the Sky High approach, and everywhere there is a hierarchy. So SPICE is called one very new one given by Central Institute of Deafness. That is basically with reference to awareness, then discrimination, then patterning. What are the pattern of sound? Different prosodic pattern, identifications of the prosodic pattern, and they can comprehend gradually. So it is basically a meaningful input. So meaningful means there should be sounds. Sounds are joined with the, and they form words. Words are more, so it is a phrase. Then phrase to sentence, simple, complex, and the compound sentence, and then conversations. So in the situational context, it varies. So sometimes it is a structured situation. So whatever we have taught, that thing only maybe recollect. For example, routine is one part, and naturalistic learning is very, very important. So if the person is learning auditorily through nature, that is the best pattern, and that is the integral part of the auditory verbal therapy. As cochlear implant users, they are using auditory verbal therapy, so we are using top-down model. So we start whatever we are with the normal hearing child, the same stimulus we should give, the same prosodic pattern to the children with cochlear implant, because we know that cochlear implant means after cochlear implantations, mostly the hearing is the fine. So they can hear even normal, very soft sounds also. Only we have to train in the naturalistic situations. So auditory training with adults also is very, very important, because sometimes they require speech reading also with reference to auditory training, because they must have some issues with the some neural loss are there or degenerative loss are there. So auditory training, like a kids, we use a lot of activity, lot of visual stimulus or multisensory stimulus in case of auditory training. So in activities for reinforcing auditory discrimination, that is very, very important. We use minimal pair. The sets of words that differ by only one phoneme, like till, chill, in that way. So auditory memory drills, we can use closed set list, like we have already numbers, days of the week we have. Based on the closed set list, we provide a sound and they have to show what is the particular words is there. So there will be a closed set words, and based on the closed set words, when they listen, they have to match what is the particular word. So that is one example of auditory memory drills. Exercises in intonations also. So sometimes we can stress, we can using rising intonation. When will it open? Or maybe the falling. When will it open? Or rising phoneme. When will it open? In that way, rising. Then when will it open? Rising first. When will? then it open the falling or falling rising. When will falling, then it open is rising. So in that way, there are a lot of variation of intonations we can train. So this is basically the auditory verbal therapy practices given by Esther Brooks et al. And we use auditory attentions, then acoustic highlighting of specific sounds, specific phonemic aspects. We use modeling language as normals. We wait for the expectantly. Then we take turns. That is a pragmatic pass we use. We use auditory closure activity, negotiating and problem solving, scaffolding, and of course social and emotional learning. So these are the area, and in this particular way, the 9 steps we use in a different level of hierarchy. What are the food for thoughts in this particular auditory learning pedagogy? First, we can use Auditory Processing Studio. This is a software. We can use this particular software that there are a lot of mixing. You can mix different sounds, different pitch contours, mid frequency, low frequency, very high frequency, and a lot of musical instrument sounds also we can train. We can train with the different speech sounds, song, music, etc. So it is basically a fully laboratory of auditory processing. So this is very, very important one software, Auditory Processing Studio. We can use LACE also. LACE is very old one, but it is still available with the proper new versions with reference to AI integrations. That is the listening and communication enhancement. It is a home-based, self-paced, adaptive auditory training program designed to improve listening and communication skills. So we have to buy this particular software. And then there are a lot of AI tools out there, like these particular instruments, they have a data science methods. So regulation hearing assistance, we have a lot of AI machine learning approaches are there, and we can transform hearing rehabilitations with different level like spatial mapping, real world stimulations, and there are a lot of deep neural network is used in different type of hearing aids in nowadays. The latest part is basically these deep brain stimulations or transcranial, repetitive transcranial current stimulations or repetitive transcranial magnetic stimulations. So you can use brain stimulations instead of the other things. It may be the different levels. So it may be the invasive, that is a chip is placed in the cortex and we are stimulating, that may be one invasive. Semi-invasive, maybe some part is there, some part is in the outside, or maybe it is fully non-invasive neuromodulation devices. Like Linear is one devices we commonly use. So another important part to understand the synaptogenesis or molecular plasticity, we can use stem cell regeneration. So it is coming up, hair cell regeneration aspects. So there are a lot of studies are coming up with reference to provide different protein to the animal's ear after the hearing loss and how it develops the hearing again, and can rewiring the auditory processing in the brains, how the synapse forms in the laboratory. So this part is very, very important in stem cell therapy. So thank you so for pleasant listening. So it is basically a overview of what do you mean by auditory learning in different level. Not only we are much more concentrating on only the persons with hearing impairment, but also when there is a person's having some auditory processing deficits also in case of neuropathy, in case of CAPD, that is central auditory processing disorder, or language processing disorders in specific learning disability or ADHD and autism. We can use all sorts of auditory learning activity in this way. So even you can take the help of the what is called the AI for this data science approach. A lot of AI tools are coming up for giving the auditory training and things. So thank you for pleasant listening.